Hi. Now we're going to talk about standardized tests, which I'm sure you're aware have uniform procedures for administration and scoring. We'll talk a little bit more about that in a minute. Standardized tests are used by OTs to assist in making a medical or educational diagnosis. Sorry, my thing is beeping. They're also used to determine whether or not a child is eligible for services. Often that's within the context of the school system, or perhaps early intervention may be another reason to determine eligibility for services. They are used to monitor progress. Some standardized tests are appropriate to be used for reassessment, and some are not. So that's a good thing to know about an assessment when you're making a choice about what to use. And then they can be used to make appropriate decisions about intervention. So this is the level the child is at. What's the next level that we want to go to? I know in my class anyway, we were talking about not challenging children too much so that they're just going to fail time and time again. And that includes using standardized assessments to make decisions about where you're going to begin with intervention. All right, so the uniform procedures in administering and scoring are always included in the test manual. Generally speaking, there's a fixed number of items on a standardized test. Now, there are standardized tests where you stop testing after the child fails a certain number of times, and so although there's a fixed number of items, how many you might actually administer is going to depend on the child and their performance. They will have a protocol for administration. You really need to look at this carefully. Some tests, like the Peabody, have very strict things that you're supposed to say and very strict protocol for when you can, how many times you can allow the child to try again. Other standardized tests, like the Brunick-Sosaretsky, you're allowed to give the child hints and assistance, and those are described as well. So you really want to know your protocol for administration as you go into giving a child an assessment. And of course, then there's fixed guidelines for scoring the test once you finish. So there's basically two kinds of standardized tests that we use: norm referenced and criterion referenced. The norm referenced tests means that the normative data that you are comparing the child to was collected from a sample of children. So more recently, we've become more aware of the need to make sure that this really is a good sample. And so you'll see in more recent testing that the normative sample was drawn from the east and the north and the west and the south of the United States, and that they looked at rural and urban areas, and that they include children of various racial backgrounds. Some normative samples include kids with disabilities, some do not. So this is all things to really look at closely and be aware of, because you don't want to compare a child to normative data that doesn't match well with that child's characteristics. So as I said, with a norm reference test, like any standardized test, has standardized protocols for administration and scoring. And this is an example of a norm reference test. This is from the Brunick-Sosaretsky. You would assess the child's ability to do these things: cut out a circle, draw a line on a crooked path, draw a line on a straight path with preferred hand for both of those. And then after scoring how the child did on these things, you would compare the child's performance to that of other children their age. In a criterion reference test, we are looking at information on how the child performs on a specific task. How do they do toileting? How do they do dressing? How do they do feeding? While you may or may not use standardized administration and scoring procedures for this, but the basic thing for the criterion reference test is that the purpose is not to compare the child to a normative sample. So if I have a 5-year-old and I'm looking at their feeding skills, I don't care specifically about how other 5-year-olds can feed themselves. I want to get information about how this child can do this specific task. So you're probably all familiar with the FIM, which is a criterion reference test for adults. And there's a WeFIM for children who are under the age of 8. Now, I'm saying under the age of 8, so there is a developmental aspect to it. But again, we're not trying to compare the child to other children their age. We're only comparing them to themselves. So here's an example of a criterion reference test. And these are dressing and hygiene skills. And these are descriptors that might tell you about how that child is able to perform those dressing and hygiene skills. So when administering an assessment, especially a standardized assessment, but also non-standardized, first you want to decide which tests you're going to learn. That may depend on what tests are available in the clinic that you're working in. For this class, you're going to be learning the Peabody Developmental Test of Motor Skills, the second edition. So you're going to want to study the test manual. If possible, you're going to observe the test being administered, and then you want to practice. And practice is important. We will be setting up practice times for you for the Peabody. If you were in a clinical setting, you would want to check your inter-rater reliability by having someone else administer and rate a test, and then you would also rate that child on that same test at the same time, and then look at how closely your ratings are to each other. You want to be sure to select the appropriate test environment. Do we want to do it with other people around? Do we want the parent there? Do we want it to be in a quiet room with a well-lit environment? So some things to be thinking about. Sometimes it's appropriate to have the parent there. Sometimes it's not. You want to become familiar with the test items. This is really critical. If you're not familiar with the test items, you're going to have a hard time keeping the child's attention, because even your most typical child is going to get tired of a testing situation. And then you want to evaluate the clinical usefulness. So there's no point in giving a test that's not going to give you useful information. Ethics in testing is important. So, is the test relevant? Again, we don't want to give unnecessary tests to kids if they're not going to give us relevant information. What are the physical requirements of the test? Can I handle the physical requirements? Can the child handle the physical requirements? This SIPT, which I talked about earlier, that's a 4-hour test. That's a long time to expect a child to pay attention, sit in a chair, and do things. So for example, with the SIPT, you can divide it up in 2 parts, and you don't have to do it all at the same time. You don't want to fatigue a child so much that they do poorly on a test where you're trying to see what is their best skill that they can give you. Are you competent? Obviously, if your results from your test are going to decide if a child gets services or not, then you want to be competent in giving that exam. You want to pick an appropriate test site. I talked about that a little bit, that you want to make sure that it's quiet and well lit, and that there are a table that's the appropriate size for the child, if a table is necessary, that sort of thing. You want to make sure that what you're testing is something you need to know, as opposed to just something that would be nice to know. Nice to know might add time and fatigue and cost to the evaluation process. So you want to really make sure it's something you need to know. And of course, confidentiality is always so important. You never know who might know whom. It's a small world out there. OT is a small world. Kentucky is a small world. The United States is a small world. So don't be talking about, how the child did in the grocery store with your husband. Okay? You shouldn't really be talking to anybody outside of the clinical setting about how a child did on an assessment. I know it's tempting. I learned this thing today, and this is what we did, and this is how the child did on it. You just want to be really, really careful about confidentiality issues. Now, the advantage of standardized testing is that they're often well known. They're commercially available. The standardized scores are understood by, let's say, everyone. Some kinds of standardized scores might need to be explained more to parents because they didn't take the statistics classes you took. But generally speaking, professionals that you work with ought to understand the standardized scores. And with the appropriate test, it can be used to monitor developmental progress. Some of the disadvantages to standardized testing is that they often focus on components of performance instead of occupations. And it's just a brief snapshot of the child. So how are they doing that day? Did they get a nap? Did they get a snack? Are they with their favorite parent or not their favorite parent? You just can't assume that how they look at that one day when you're doing that assessment is actually how that child normally functions. And testing procedures can be very inflexible. So if the child comes in and they don't understand English very well, and you can't do it in English, and there's no standardized copy of that test in Spanish, then you cannot say that you've given a standardized assessment, even if you know fluent Spanish and can interpret the instructions for the child. The young child. So sometimes separation from the parent doesn't work out so well. That can be negotiated. It's just, if the parent is there, you have to make sure that they're not prompting the child or helping the child too much, or actually helping the child at all, depending on the standard, how the test was standardized. A lot of times kids are very distracted by novel situations, or they're not happy with, the kids we work with, kids with autism are often very unhappy with novel situations. You may encounter a lot of resistance. We'll talk some more about how to get kids to help you get kids to participate when you're doing something, and ways to help motivate the young child. But you can't tell a little kiddo, the way you can tell an adult, I really need to do this test so that I can do my best job in therapy, because really, a 2-year-old doesn't care much. So the most important thing is to be prepared. Know your tests. Make sure you have all your test items. Have things maybe organized so that you can just move from one item to the next. Be sensitive to the child's needs. Be careful about the environment. We've talked about that a bit. If you can, it's really good to take a little bit of time to build some rapport with the child. Can you offer them stickers? Can you get them to laugh? Can you make them feel comfortable? You want to give the child positive reinforcement when you're assessing them, but do not tell them they're doing a good job, because what are you going to do when they're not doing a good job? Or if they're not doing a good job, they know they're not doing a good job. So it's better just to say, I really like the way you're sitting there. I really like how hard you're trying. No, that's not a good one. Gee, that's a pretty pink dress you have on today. You want to kind of work on your list of positive reinforcements that don't directly comment on the child's ability to take the test. And most importantly, be patient. Lots of deep breaths. Patience. So that's the end of part 1. Now I'm going to do the third video, part 2. Part 2 of the developmental assessment. So you need to switch your PowerPoints.